Someone who is no stranger to this community. She has been here a number of times, talking about a number of issues, certainly on the Affordable Health Care Act. She has been passionate, she has persevered, and she really is an articulate spokesman for why this is so important and why it is that we are here today. Kathleen Sebelius has been a friend of mine for a long time, a lot of years. And we were indeed. And it's exciting to see the amazing work that she's doing. And obviously on my left is Tampa's dear friend and Tampa's partner in Washington, D.C., my cohort in crime, Congresswoman Kathy Castor, who does just tremendous work for us. I couldn't have a better friend in Washington, D.C. than I have with Congresswoman Castor. So thank you for all you do. But we're here today to talk about affordable health care. We're here today to talk about the 96,000 residents of this community. My tax-paying citizens, my friends, my neighbors, the folks that elected Kathy and I to do the work that we do. 96,000 people in the city of Tampa do not have health care. And if you think about what that means to them and to us as a community, that means that they are not getting the adequate health care that they need, and that they end up going to the emergency rooms and using emergency room physicians and doctors like my wife as their primary care physicians because they don't have access to affordable health care. That means that they're calling Tampa Fire Rescue as their primary provider. And our men and women are running on calls to people that don't have health care insurance, that if they did have health care insurance and they could address some of the chronic needs that they have early in the process before they become chronic, before they become debilitating, before they become an emergency and they have to call 911 and show up at Tampa General Hospital or St. Joe's Hospital in acute conditions that end up costing all of us who will pay that bill significantly more than if they had health care insurance and they were able to address these needs at the beginning of the process, whether it's diabetes or whether it's a child that's about to be born. The question becomes, do you get health care insurance and do you get prenatal care and it costs a little bit? Or do you show up in the emergency room and have that baby be $1 million baby that all of us will pay for the rest of its life? That is the fundamental question. So what we are doing here today at the City of Tampa is we are all in. We are all in. We are opening up 9 of our recreation centers, one of which you are standing in here today. We will allow navigators to establish a presence here. We will have regular hours that our constituents, our citizens who don't have access to health care can come to our recreation centers and get signed up. They will have navigators there to help them through the process. We are going to be engaging our Tampa Fire Rescue personnel who, when they go on calls, will have materials to leave behind for patients that they are visiting, patients that need that health care insurance, who, if they did have that health care insurance, wouldn't have to call 911 to have Tampa Fire Rescue come and provide that service. We're going to be doing PSAs. We're going to be engaging, and I see Pastor Bartholomew Banks there, who is the president of, and you're going to have to help me, Bart, the Baptist Convention in the state of Florida, the entire state, who has agreed to help us, along with a number of other pastors, to reach out to the faith-based community, to get them engaged, because oftentimes their citizens and their congregants are those that are most at risk. We need their help to spread the message. But I'm here to tell you that this city is going to do everything that we can to the extent of our ability to make sure that our citizens have the opportunity to sign up for affordable health care. Folks, this is not a bill. This is not a wish. This is not a dream. This is not debatable. This is the law, and we are going to comply with the law, and we're going to get our folks engaged and signed up, because ultimately the quality of their life is what Kathy Castor and I were charged to do and to protect and to advocate for. This city's all in. It's game day. We've got 11 weeks left. We're going to do everything we can to make sure that we sign up as many of our citizens that need this. It's in our best interest, both economically and morally. We have an obligation to make sure folks engage in this. Now, the person who's been the most passionate spokesman for this across the country, in good times and in bad, in websites that work and websites that don't work, they're working now. And there is no excuse for anybody not to sign up. My friend, and a friend to everyone in this country who is in need, Secretary Kathleen Sebelius. Secretary, welcome to
Well, good morning, everybody, and I'm delighted to be back in Tampa with Mayor Buckhorn and Congresswoman Castor and a great navigator who you're going to hear from in a minute. There are not a lot of better health champions than Kathy Castor, not just for here in Florida in her district, but really for people across the country. And it's been a great privilege to work with her on this important and historic effort. Bob Buckhorn and I have known each other for a long time, and he is in a unique role. Mayors play a unique role to their constituents, and a unique role when it comes to health care. Often the most personal relationship that anybody has with an elected official is with their mayor. The go-to guys and gals around the country who are actually delivering on very personal services. They know intimately about constituents who have lost homes or lost assets because of unpaid medical bills. They know that their kids in communities across this state who don't do as well in school because they are ill and they don't have the kind of health care they need. They know that there are folks sleeping in the streets and sometimes in county and city jails because they don't have access to substance abuse services and mental health services, or they could be productive members of their communities. And they know that there are hospitals everywhere in Florida and across the country where the bottom line of those hospitals is jeopardized because too many people are coming through the doors and don't have any way to repay for those services. So having the mayor say they're all in is hugely important. I think the kind of announcement that Mayor Buckhorn just made is typical of what we're seeing. I would say typical may be too generous. He is a huge leader, so we're going to try to make this more typical, where the mayor has been very creative and strategic, looking at where in this city people come together, where young people come to play basketball, where there are opportunities to get information to folks who may not wake up every morning and thinking about health insurance, but need to know the benefits that are available under the law. So here in Tampa, looking at the opportunity to open up rec centers and make sure that navigators are available is huge. I just came from a wonderful Energized meeting in Pinellas Park with another group of navigators just down the road, and they are also looking at ways that they can use assets in their county to make sure that people know about the law. So we've got very dedicated and engaged people. One of the things that we're reminding people is that if they sign up for coverage today, their coverage can begin as soon as February 1st. But as the mayor said, 11 weeks are left in open enrollment, 11 weeks from today, all the way till March 31st. So people need a little more time. They want their questions answered. There are multiple ways to sign up. Healthcare.gov is a very different website than it was on October 1st, thank God. And it is easy to navigate, easy to use, and people can go on the website. But a lot of people like to talk to live human beings. So we have a toll-free call-in number at 1-800-318-2596. Callers in Spanish and in English, and translation in up to 150 languages, knowing we have a big and diverse country. And then there are people on the ground, like the navigators you'll hear from today, people here at the rec center, people at every community health center. Because of the Affordable Care Act, we now have an opportunity to change what has been a pretty dismal picture. Here in Florida, 3.5 million Floridians have no health insurance at all. About 23% of the residents of the state, no health insurance at all. And you've heard the mayor talk about those numbers here in Tampa. Prior to the law being passed, a lot of people didn't have choices. They didn't have affordable coverage in their work.